following attendance at hospital due to a fall. The vision for the future of care in Wales is for everyone to have more effective, person-centred, community-based care provided by health, social care, housing and public and private sector partners working together. At Healthcare Inspectorate Wales, we are responsible for checking that people receive good quality healthcare. We have undertaken a national review of integrated care with a focus on falls, which assesses how systems work together and makes recommendations for how they could work together better. Following attendance at hospital due to a fall. This is Piotr. He is an older person who has attended hospital due to a fall. If the services that are in place to care for and support Piotr don't work together in a joined-up way, he may experience an unnecessary admission to an acute hospital, failure to regain the former level of independence and quality of life he had prior to his fall, and missed opportunities to solve the root cause of his preventable falls. In a joined-up system, Piotr can expect, in the absence of a need for hospital admission, access to services to get him back home that day and to keep him well at home. Realistic discharge planning that starts alongside his admission and which includes a plan to deliver active reablement to regain his best level of independence and quality of life in accordance with what matters to him. To improve the care and support Piotr receives, we recommend falls in people aged over 65 should be a priority in its own right. Increase public engagement around significance and preventability of falls. Value the social care workforce. Fund preventative resources. Standardize a national framework. Deliver clear local models of joined-up care. Everyone who works in the system should aim to deliver person-centred care. Develop a sufficiently trained workforce to meet the needs of the population. For more information and to read the report, go to www.hiw.org.uk/falls review.